Good afternoon and welcome to the Rotary Club of Madison. I'm Anthony Gray, Club President. Thank you all for joining us today. Please remain standing for the opening patriotic song. Dick Lovell will lead us in singing This Land with Casey Opers on the keys.
Grateful for the wonderful land we live in and acknowledging that other peoples lived here and cared and loved this land long before we arrived. We sing this patriotic song that's a song for all Americans. This land is your land. This land is your land. This land is my land. From California to the New York Island. From the redwood forest to the Gulf Stream waters, this land was made for you and me. As I was walking a ribbon of highway, I saw above me an endless skyway. I saw below me the Golden Valley. This land was made for you and me. This land is your land, this land is my land. From California to the New York Island, from the redwood forest to the Gulf Stream waters, this land was made for you and me.
Thank you, Dick. Today's meeting sponsors are Cheryl Whitkey and Becky Steinhoff on behalf of Safe Communities, as well as Dave Bornstein, principal of High Point Residential. Safe Communities is a 501c3 coalition of over 350 organizations serving Madison and Dane County. Safe Communities cares about health, well-being, and safety of all people in our community. By engaging a coalition of advocates, including those with lived experience, we emphatically provide support and resources to vulnerable populations. They are saving lives together by confronting our community's top safety concerns: older adult falls, traffic crashes, suicide, and drug harm through innovative programs. Our vision is to set the standard for community safety as a trusted catalyst that fosters innovation and collaboration. High Point Residential is a multifamily company specializing in the acquisition, management, and development of multifamily rental communities. With their 25-plus year successful track record and strong industry relationships, they have developed over 3,000 multifamily contacts and a solid reputation that has led us to review opportunities before others. Our thanks to Cheryl Whitkey, Becky Steinhoff on behalf of Safe Communities, and Dave Bornstein on behalf of High Point Residential for their support of today's luncheon. Connor Moran will now join me at the podium to introduce today's guests. You got a fan?
Just one fan. Thank you to all of our guests for joining us and all of our Rotarians for joining us at Rotary today. Guests, as I say your name, please stand and then we will applaud you at the end. It's the best part of being a guest at Rotary, except for hearing Anthony and our speaker. So our guests today are Kayla McGee and Sophia Snow, who are guests of Bob Shoemaker and the Ethics Symposium Committee. Rebecca Foss, guest of Cheryl Whitkey. Tana Elias, guest of me. Melissa Simonson, guest of Darren Harris. Tristan McGough, guest of Diane Everson. Catherine Aherney, guest of Linda O'Hearn. Tamara McKinney, guest of Lindsay Giese. Corinda Rainey Moore, also guest of Lindsay Giese. Erica Renzi, guest of Lindsay Giese. And Holly Birkenstadt, guest of Lindsay Giese. Yeah, she came to play today. Bethany Ordaz, guest of Sandy Morales. Laura Tran, guest of Sarah Eskridge. Jane Boutel, guest of Steve Mintz. Candace Welsh, guest of Fred Mose. and Karen Kraus, guest of Scott Hummerson. Thank you to all of our guests for joining us today.
Now one of my favorite parts of the agenda. I am pleased to introduce 4 new members today. We'll start with Caitlin Bosch. Would Caitlin please stand? Okay. She's sponsored by Cedric Page. Caitlin is the Chief Strategy Officer at Black Men's Coalition of Dane County. She was born and raised in Madison and lives with her partner, Max Flatton, on the east side of Madison. Caitlin holds a bachelor's degree in Gender and Women's Studies and in Political Science from the University of Wisconsin-Madison. She's the former coach for Millennium Soccer Club and a current coach for Girls on the Run of South Central Wisconsin. Caitlin enjoys camping, cooking, reading, bird watching, movies, live music, and playing soccer. Please remain standing. And will Ruby Conrad please stand with her sponsor, Susan Schmidt? Ruby is a realtor and owner of Conrad Development. She attended Edgewood High School in UW-Madison. Ruby and her husband Chris live in Monona. She has served as a writer and creator of several Emmy-winning shows in children's educational television. She received an Emmy for her show Ruby Studio. Ruby is a Spanish speaker, having volunteered and studied in Latin America. She volunteers her time for La Jornada, a subsidiary of the National Youth Advocacy Program. She's also a board member of the Madison Ballet. In the 90s, Ruby was a scholarship recipient from Downtown Rotary for rainforest preservation work in Ecuador. And will Chris Laurent please stand with Ellen Carlson? Christopher is president of Sinair Solutions. He was born in La Crosse and moved to Madison for college in 1985. He lives with his wife Christine in Oregon and has 4 children. Christopher holds a bachelor's degree in zoology from the University of Wisconsin-Madison and a master's degree in servant leadership from Vitterboro University. He is also applying for a Doctor of Education degree from Vitterboro University. Christopher has held multiple positions within the community, including serving as the president of Do Good Wisconsin and Porchlight. He served as vice chair for Forward Community Investments, treasurer of Dane County Housing Authority, and the Madison Reading Project. He's also affiliated with ULI, the Detroit Local Product Council. Lastly, Christopher is an adjunct lecturer at both the Milwaukee School of Engineering and Marquette University. In 2008, Christopher was featured in the Wisconsin State Journal's Know Your Madisonian series. He enjoys camping, playing guitar, mentoring, and public speaking on servant leadership. And finally, will Michael Moody please stand with his sponsor, Ron Luskin? Here we go. Michael is co-founder and CEO of Catalyst for Change, Inc. Michael was born in Lawrence, Kansas, and he moved to Madison from Richland Center in 1989. Michael holds a bachelor's degree in philosophy and a master's in social work from the University of Wisconsin-Madison. Michael enjoys reading and cooking. Please join me in welcoming all these new members to the club and thanking all the old members for the introduction. It's November, so that means it's time for us to launch the annual fund drive to benefit our Madison Rotary Foundation. Mark Clear chairs this year's fund drive, and he's traveling out of town today, so he's prepared a short video Let's hear his opening message about our fund drive.
Hello, fellow Rotarians, and welcome to the 2025-26 Annual Fund Drive. I wish I could be there to celebrate this important occasion with you, but I am currently in the sunny Pacific Northwest. Let's get right to it. Our fund drive goal this year is $160,000. That's an ambitious goal. It's driven by a desire to fund at least 50% of the grant requests we receive. It's also an attainable goal. Adjusted for inflation and for the size of our club, this is less per member than we've raised in the past, so we can do it. Here's another goal, fast response from all of our members. To get there, all we need to do is for everyone to complete their pledge form, either on paper or online, as quickly as possible. The faster you respond, the less you'll have to hear from me, and that's something we can all get behind. See you next week, Rotarians.
Becky Steinhoff chairs this year's Excellence in Education Committee, and so please welcome her to the podium so she can make an introduction. Becky?
Hi, everyone. 2 weeks ago, we announced the 6 Excellence in Education grants being awarded this year, and we are able to provide these grants thanks to our generous members for making donations to the annual fund drive, which I'm sure everyone is going to do in a speedy manner. The grants include Journey Mental Health, MADAM, Roots to Rise, the Simpson Street Free Press, Wisconsin Youth Symphony Orchestra, and the Madison Public Schools Foundation. Today, these grants are providing valuable resources to local organizations for projects that are enhancing access to quality education while collaborating with schools and other nonprofits to leverage resources and expertise. Throughout the campaign, each week, we will feature one of our 6 impactful gifts that we are distributing. Today, we are going to hear about a $40,000 grant we are providing to Big Brothers and Big Sisters of Dane County, and we have 2 staff, our own Sandy Morales and her staff, Bethany Ordez, here with me joining us today. Our Madison Rotary Foundation grant to them is expanding their school-based mentoring programs, and we have a short video so we can learn more about that.
At Big Brothers Big Sisters of Dane County, volunteers create meaningful connections every day that help students build confidence, resilience, and the skills they need to thrive in school and life. Thanks to the Rotary Club's generosity, we're able to expand these life-changing relationships to even more youth in our community. Our school-based programs pair caring mentors, both high school students and adult volunteers, with elementary students for weekly sessions during the school day. Together, they explore leadership, socio-emotional learning, teamwork, and identity development while building trust and friendship. The students we serve often face challenges like financial hardship, trauma, or a lack of supportive adults at home. These obstacles can affect learning and confidence. Through consistent mentorship, students gain encouragement, develop important life skills, and build a sense of belonging. Last year, nearly all mentees improved or maintained positive behaviors, and most reported higher educational expectations. Mentorship isn't just transformative for the youth. It's a growth experience for mentors too. High school students develop leadership and communication skills while making a lasting difference. Community volunteers, like the Rotary Club, are essential partners. By joining events, helping with activities, or sharing expertise, they create unforgettable moments for students and strengthen the program's impact. Thanks to the Rotary Club, we can continue building these meaningful relationships and expanding opportunities for students who need them most. Together, we're helping youth discover their potential, connect with caring adults, and thrive in school and beyond.
certainly a worthwhile use of our dollars. I also wanted to quickly mention that I participated in the Rotary Youth Scholarship Awards, and when we were doing interviews of the prospective scholars, there were a lot of them who verbalized that one of their favorite things about high school was being a mentor in the Big Brothers Big Sisters school mentoring program. So I just wanted to add that little tidbit of great information.
Thank you so much, Becky. I guess I'm filling in for Jason on this one. Our Rotary Club has a board of directors. It's made up of 12 members who are serving 2-year staggered terms, and the immediate past president also serves a 1-year term. Our current board members are Rhonda Adams, Joy Cardin, Sarah Estridge, Aurelia Estrada, Mike Gotzler, Jason Ilstrup, Janine O'Rourke, Janet Perino, Robert Reed, Julie Swenson, Angela Titus, Charles Tubbs, and Bob Winding. Let's give them a round of applause. As I mentioned, the board has 2-year staggered terms, so Rhonda, Sarah, Aurelie, Janet, Bob, and Robert's terms will end June 30th. We will be electing 6 new board members to replace these outgoing board members. The Directors Nominating Committee has a list of things to review as candidates are being considered, such as, has a member served as a chair of a committee or fellowship group? Have they supported our annual fund drive? Do they attend weekly meetings? We also look at other commitments in Rotary that members might have. This year, the nominating committee reviewed over 50 names, and I'm pleased to introduce 12 nominees. The following members have agreed to place their names in nomination: Dewey Bradison, Mike Engelberger, Tara Grays, Maria Hayda, Amanda Jobs, Renette Maurer, Connor Moran, Mary Ellen O'Brien, Cedric Page, Wendy Wink, Greg Zarkowski, and Tanya Zastrow. Next Wednesday, the membership will select 6 of these leaders to join the board for a 2-year term beginning next July 1st. The 12 nominees represent the future leaders of our club, and any combination of these 6 will serve our club well in the next 2 years. There were photos and brief bios on each of the 12 nominees in the Rotary News. Thanks again to the 12 who have agreed to place their names in nomination this year, and if you cannot attend next week's meeting, you will automatically receive an electronic ballot immediately following our luncheon with a November 13th noon deadline. So we're choosing the next leaders. Lost and found, we have a bit of housekeeping. These items were left behind at previous Rotary meetings here at the Park Hotel. A purple vest with AirPods in the pocket, a black notebook with a Wolf Sub-Zero logo, a beige Windex Senso Diva hearing aid. These items will be located at the button box so you can pick up any of the ones that belong to you. We have some birthdays to celebrate with a bit of wisdom or humor that complements Rotary's mission. We encourage members to make a gift to our foundation's Community Grants Endowment Fund that represents their age, rounded up to 100, for our Synergy Scholarship Fund. On November 2nd, we have Brian Anderson. November 2nd, Peter Calvi. November 2nd, Eric Krivov. November 2nd, Victor Rodriguez. November 4th, Brian Espinosa. November 6th, Dennis Hall, who says, once you get past my charm, good looks, intelligence, and my sense of humor, I think it's my modesty that stands out the most. Also, November 6th, Michelle Harris. November 6th, Mary Murphy. November 7th, Steve Mintz. November 7th, Roberta Slatsky. November 8th, Kyle George. Thanks to our celebrants for their contributions to the Madison Rotary Foundation Community Grants Endowment Fund. Please join me in wishing all of them the happiest of birthdays. Happy birthday to you. Happy birthday to you. Happy birthday, dear Rotarians. Happy birthday to you. Our speaker today is Dr. Jasmine Zapata, who is an award-winning author, national speaker, double board certified physician, visionary public health leader, business pioneer, and mother of 4. In addition to practicing in the hospital and holding statewide physician leadership roles, she is passionate about stepping outside the clinic walls to explore upstream and innovative approaches to improve birth outcomes for all. Dr. Zapata has many lived experiences, help her uniquely connect with the community she serves, and she is well known for her infectious energy, passionate advocacy, and heart for service. She has titled her speech, A Personal Behind-the-Scenes Candid Conversation with Dr. Jasmine Zapata on Combating Black Infant Mortality in Wisconsin. We look forward to her presentation and have made a contribution to the Rotary International Polio Plus Fund as a way of saying thank you for speaking with us today. I want to mention that we'll have Q&A with our speaker as time allows, but please wait for the microphone if you have a question. Please join me in welcoming to our podium, Dr. Jasmine Zapata.
I've been made aware that one of the biggest missions of the Rotary Club of Madison is to achieve greatness for ourselves, for our community, and for our world. Let's give a hand if you agree with that mission. Clap if you agree with that mission. There is an area right now that needs attention if we truly want to achieve greatness for ourselves, our community, and our world, and that is the area of infant mortality. My question for you today in the time that we have together is to ask yourself, what more can I do to combat Black infant mortality in Wisconsin, and particularly Dane County, because that's where we're at right now? What more can I do? Everyone say that with me. What more can I do? Okay, say it with a little more passion. What more can I do? What more can I do? All right. And I want to share my personal journey asking myself this question to just illustrate my personal and professional journey to answer this question, and I want it to inspire you. And at the end, we'll have time for discussion, and then you can answer that question for me, okay? Because I'm gonna ask you again at the end. I first asked myself this question when I was in college in Marquette University in Milwaukee. When I went to Marquette, I joined a group that was focusing on combating Black infant mortality in Milwaukee. I wasn't really aware of the issue, but when I started going to the community meetings, I learned that Black babies were dying at almost twice the rate of white babies in Milwaukee and weren't reaching their first birthday. As a young college student, I was so excited. I knew I was in pre-med and wanted to go to be a doctor. And so I was so excited about going to those meetings and learning all about it. I was thrilled when I got accepted into the University of Wisconsin School of Medicine and Public Health to reach my dream of becoming a doctor. I came to Madison with a little baby. I got married to my high school sweetheart during college, and then during my senior year of college, I had a firstborn, a beautiful son. I made it to Madison for medical school, but then in my second year of medical school, the very statistics that I had read so much about and studied came alive for me. I was pregnant with my second child, who was due January 2nd. But on September 20th, I felt sharp pains in my lower abdomen. And within 2 hours, I gave birth to a 1.5-pound infant. At only 25 weeks gestation, when she came out, most babies cry and there's so much excitement in the room. But when she was born via urgent C-section, the room was quiet because her lungs were too fragile to breathe and work on their own. She had to get emergently placed on life support and taken to the neonatal intensive care unit. I was so horrified because I knew that one of the leading causes for Black infant mortality in Wisconsin was due to complications of prematurity. And now I am here with a premature baby that's fighting for her life. Over the next several months, I was faced with a lot of hard decisions. She ended up having to have multiple brain surgeries because she was born so young, she had life-threatening brain bleeds. She had life-threatening infections, and I'll never forget being on campus studying and getting a call saying you should get here to the hospital because we don't know if she's gonna survive overnight. But at that moment, I had two decisions. I had one decision to make. I could either quit and give up my dream of becoming a doctor, or I could use this experience to fight. And I decided to keep fighting, to keep pushing, to keep praying for her, to keep advocating for her. And thankfully, she survived. After 3 months in the neonatal intensive care unit, we were able to take her home. However, there are so many babies and so many families that do not have that same experience. Even outside of my role in the medical field, I have personal family members and loved ones whose babies were born too early and too soon, and they had to say goodbye to that baby and didn't get to bring the baby home. And as I brought my baby girl home, I knew, even though this is one of the hardest times in my life, because she still had many health obstacles to face even after we brought her home, I asked myself, what more can I do to combat infant mortality in Wisconsin? I've been given this gift to bring my daughter home. What more can I do? I asked myself, why is it that college-educated Black women have much higher rates of preterm birth compared to white women who haven't even finished high school? Even when you adjust for social economic factors, we still see inequities and disparities. And it is not right, that is not greatness for our community when there are people who cannot have a baby that makes it to their 1-year-old birthday. So on my quest to say, what more can I do? My first decision was, okay, I brought this baby home, now I gotta graduate medical school. And I had a lot of support from my friends, my faith community, my administrators, and I was able to still graduate medical school. And I stayed at the University of Wisconsin to become a pediatrician because I wanted to continue looking into this into this question. As I was going through my pediatrics training, I really began to get really interested in what are some of the root causes to why babies are born prematurely? What more can we do about it? And so I decided to get another degree in specialization in preventive medicine and public health to really go upstream and ask, what more can we do? What are some of the root causes? While I was in my training, I was so thankful to be able to, to be able to really rally other people to fight this issue. This is a picture of shortly after the pandemic when a lot of the rallies and marches were going on. And we were able to convene over 1,000 white coats or healthcare professionals from across the state to join us at the Capitol to talk about how we can combat racial inequities in our healthcare system. What more can I do to bring awareness to this issue? I also was able, there we go, oh, this way, okay, here we go. I also had the honor of joining the Fetal and Infant Mortality Review Team in Dane County, and I think we have some representatives from public health here. All right, I saw a couple before, but I had the honor of joining the Fetal and Infant Mortality Review Team, and today I'm here just representing myself, but I couldn't help but to share a few of their data and statistics. This is a really important resource if you want to really dig in and learn more about infant mortality, particularly in Dane County. It's the Maternal and Infant Health Data Book that was recently published earlier this year. And the biggest takeaway for Dane County as it relates to infant mortality is that the highest rate is based on the same thing that impacted me several years ago, babies being born too early and too soon. That is what's driving our infant mortality rates. And preterm birth rates are highest among Black babies in Dane County. And that's very important to know. This QR code here gives a link to the entire Maternal and Infant Health Data Book if you are interested in learning more about that. Also, as far as characteristics of maternal characteristics for this, during 2021 to 2023, infant mortality rates were higher among babies born to mothers and birthing people less than 20 years old, unmarried people compared to married people, and mothers and birthing people with Medicaid or Badger Care. In this report, it also highlights some of the great work that is happening to combat this issue. And one of the key findings that we see in all of our literature and all the work that we do is that one of the biggest things we can do to address this issue is going upstream. A lot of the research shows that mothers and birthing people who are younger, have less education, or chronic stress over a lifetime is what is contributing to the infant mortality rates that we see and the inequities. And so as I'm sharing this information, even for that data book, I want you to be asking yourself that question that we talked about at the beginning. What more can I do? What role do I play? Because we see that social and economic factors play a role, whether you are in the social work space, in the philanthropy space, in education space, in the housing space, all of those things are so important when we combat this issue. As I went along my journey in the medical field, I kept asking myself that question as well. What more can I do to bring clarity to this issue? And I had the opportunity to engage in qualitative research with Black women across Dane County to say, from your point of view, what can we do to support you more? What is needed to combat infant mortality in Wisconsin and promote maternal and child health? And I had a phenomenal opportunity to connect with so many mothers and birthing people across Dane County. And I recently published, even though I am here as my personal self today, I couldn't help. I still have to share my research from UW because it's powerful. Any situation, any inequity that we're working to solve, any community problem, who knows that the most important person to talk to is the people that are most impacted? Okay, I have one person that agrees with that. Okay, all right, okay, I guess you do. And so I wanted to go ask the women that were most impacted, what can we do? And here's just some of the, a snapshot of the results. That QR code leads to the full published paper. It's open access. Community identified strategies for how to build Black birthing people's trust in the healthcare field, because that was something huge that we saw. There was a lot of distrust and broken connections. Some of the things that they said, these are community identified solutions. Employ more Black providers. I won't even get into how many inequities there are even in minority providers going into the medical fields. But that's something that they're saying they need. Listen to Black birthing people, exhibit cultural humility, engage in shared decision-making, build personal connections with patients, and spend more time with patients. These were some of the things that were mentioned as far as how to rebuild trust with the healthcare system. In a quest to say, well, what more can I do? I am so excited that I was able to join the Wisconsin Department of Health Services as the state epidemiologist and chief medical officer for maternal child health and chronic diseases. This was in a quest to say, how can we go upstream? What more can we do? My heart broke, and it continues to break every time now that I am working within the medical field, when there's a baby in my hand that we have to do CPR on, or who comes out and is not breathing or does not make it. I've been to several funerals of infants that didn't make it to their first birthday. And to watch the pain that that brings is something that drives me. And on my quest to say, what more can we do? I'm so excited that I've had the opportunity to work with the Department of Health Services on this mission. And in our Bureau of Community Health Promotion, we do a lot of work with our maternal child health funds and figuring out ways we can combat infant mortality and prematurity. And this is something that I also want to emphasize for everyone in here, whatever journey you're on, whatever your mission is, everything that happens to us in life is for a bigger purpose and reason. When I had my daughter prematurely, I didn't understand why that was happening, but I knew it was for something. And now all these years later, she's 15 years old now, going on 21. Let's clap for that. I have the amazing opportunity to share that story of what happened with me to hopefully inspire you of what you can do to help save babies. I have the amazing opportunity to still work clinically in the newborn nursery, attending C-sections and deliveries, helping babies. And I have the amazing opportunity to work at the Department of Health Services to figure out solutions and systems level change. And being the state epidemiologist and chief medical officer for maternal and child health, I would have never known I would have that opportunity. But everything on my path was preparing me for a moment like this, and it is such an honor. But that's not where it stops. I keep asking myself the question, what more can I do to combat infant mortality? What more can I do to make sure that babies reach their first birthday? And I'm aging myself showing this picture, but I think some of you might know. Does anybody know, did anybody remember this movie? Back to the Future. That used to be my favorite movie. And when people ask me what type of doctor I am, I always say I am a time traveler. Okay? That's really, and is it okay if I talk go a little bit further upstream? Is that okay? All right. A lot of times when I speak, I am officially here in my DHS role, or I'm officially here as a doctor at UW. Is it okay if I just be my full self? I'm just a mother right now? Okay. And so one of the areas that I think that we can do better at to combat infant mortality is to truly be time travelers and take an upstream approach. We're already doing it a little bit, but there's even more that we can do. Something very striking to me is in one of my roles at the state, I'm the co-chair of our maternal mortality review team. And the number one cause of maternal mortality is overdose in mental health conditions. And every time we review those cases, I've reviewed now hundreds of autopsy records, hospital records, the gruesome details of these deaths that impact infant mortality as well. One of the biggest things that we see is there is childhood trauma. What caused that individual that overdosed to start with drugs in the first place? We see that there's some type of childhood trauma or adversity that impacts them, and we know that adverse childhood experiences leads to higher rates of risky behaviors, overdose, and preterm birth and adverse birth outcomes. So if we truly want to impact infant mortality, we need to time travel, and we need to reach these young people before they even get to our delivery rooms and make a bigger investment in our youth. The mothers that we see at the hospital that are fighting for their lives or have babies who are born premature, I ask myself, what if I could travel back in time and meet that mother when she was 9 years old and let her know you are worth it, you are important, you can make it when she's facing adversity. And that's what led me to be a time traveler and ask myself, what more can we do to combat this issue? I started my own book series called Beyond Beautiful. And what Beyond Beautiful means for young people is that you are more than what people see on the outside, particularly young girls. You are powerful, you are courageous, you are resilient. No matter what happened to you or what is happening to you, you can make it. And so one of the biggest things that pushed me to even get started with writing that was because as I was in my medical training, over and over again, we would see young people come in after failed suicide attempts. I'll never forget working in the ICU in my training, and a young girl came in after hanging herself. They found her seconds before she died, cut her down, and she came on the Flight for Life helicopter to our ICU. And as I was working on the medical team, entering in orders and being on the team to save her life, I heard a voice inside of me say, Jasmine, even though you are a phenomenal doctor, you need to reach these young people before they even get here to let them know you are beautiful, you are worth it. You need to be in community centers, you need to be in schools, reaching these young people, helping them to face adversity, helping them with economic empowerment, letting them know that they can make it. And so that's how I started my Beyond Beautiful Girls Empowerment movement, and now we have done a 14-city national tour. We have partnered with organizations to be able to turn our book into a curriculum. We wrote a book for boys and girls called Life is a Battle, but You Will Win, and it talks about mental health and empowerment for even when you're facing hard situations. And I said, what more can I do to continue to go upstream? And a lot of people ask me, like, Dr. Jazz, how did you write a book? How are you doing all of this? How did you have your book translated into other languages and abroad? And so I have a team that helped. We started a book publishing company where we've now helped over 300 authors nationwide write and self-publish books to uplift young people and combat the youth mental health crisis. Yes, thank you, thank you. It's really important as we face these issues to figure out what are non-traditional ways we can combat this issue. And as a result of the ripple effect of some of the amazing authors we've worked with authors who are leaders of nonprofits that write books themselves to empower youth and donate all of the proceeds to youth empowerment work. We've worked with several authors that are doing amazing things, but also as a result of the things that we've been doing with the publishing space, I've been able to involve myself in real estate investing and actually help young people whose families have been facing crisis or adversity have a home. We've been able to start family businesses related to trucking and help people who have been formerly incarcerated have jobs. Now, some people say, Dr. Jazz, why is your family doing all that? Because I asked myself, what more can I do to combat infant mortality in Wisconsin? And all of those things are social determinants that are impacting our young people and in turn, the birthing people that are giving birth. So if we want to make a true change, we need to go upstream. And so to close, I just wanted to show a picture of my daughter now. Let's clap one more time. One more time for my beautiful daughter. She's 15 now, and she just earlier this year got her first job, which she's so proud of. Those are all 4 of my kids. And she is just the light of my life. And I always think back to when she was born and why this topic is so important, because she almost died and was one of the infant mortality statistics. There's so many babies that don't have her same story and never make it home. And that's why I'm asking you today, what more can you do? What more are you willing to do to combat infant mortality in Wisconsin and make sure that every baby makes it to their first birthday and beyond? Thank you.
Thank you. Thank you. Thank you so much. Thank you. And we have a little bit of time for questions. I did want to say that I am going to be at the end, at that table over there. I have, I think, almost everyone. I just wanted to say thank you for committing, because raise your hand if you've decided to do something about this topic. Either you're going to continue to do something or you're already doing something. I have free books. Some of the books that I mentioned, free books that if you just meet me at that table, I'm just giving out free books today. Please give it to a young person you know, somebody who could use it. Give it to somebody who needs to write a book. Just please help me spread those, but I'm giving away free books at the table at the end. All right. We have a question over here. Okay.
Thank you, Dr. Zapata. Yes. Nutrition is one of the most important, social determinants of health. Yes. Could you speak to what you're doing in terms of nutrition, especially in light of potential cuts to WIC and SNAP?
Yeah, that is a great question. There's a lot of great work going on locally and even at the state level for nutrition. In our okay, let me give this disclaimer. I'm here as Jasmine, my individual self, but I can't help shout out the work of DHS, and we have Paula Tran, who's our state health officer. Shout out to Paula. I get to work with her. But this is public information, but I'm still gonna shout out Department of Health Services. There's a lot of great work going on at home, There's a lot of work working on figuring out ways that insurance companies can help pay for medically tailored meals so that insurance would cover meals, especially for pregnant people. So even outside of WIC, there's a way that we can make sure everyone gets what they need. And we're also fighting at the state level to get funds released for the SNAP program. Yeah, there's a lot of lawsuits going on right now, but there's a lot of great work fighting on the inside to help people, especially those November benefits, to be able to get them. Great question.
Dr. Jazz, there was one other thing that you're doing that you haven't talked about, and that is actually, can you speak to your online platform of helping BIPOC communities become medical doctors?
Yes. So mentorship is huge. Remember that study that I showed, the research study that I did, Black women are saying we want to enter into the healthcare space and see more people that look like us. Less than 6% of physicians are African American. And so I started a mentorship group called the Madam Dreamers Academy, and we started with just a handful of my mentees online, but now it's grown to over 2,000 members from across the country, young women from minority backgrounds who want to go into the medical field. So we do mentorship, we have shadowing opportunities, and then we hold in-person events every year. And it's just been really amazing because there are so many young people, especially from minority backgrounds, who want to be doctors or in the medical field, but they face severe barriers. And so what more can we do to help combat this crisis? That's something I did, so thank you for highlighting that.
Thank you for your presentation, wonderful. What can we do to reduce teen drinking and smoking? That's also is a big issue in all high schools.
Oh, amazing question. You're gonna need to invite me back for a part 2 to talk about that. But one of the biggest things that we see is always, I told you I'm a pediatrician, but I'm board certified in preventive medicine. So I'm always thinking about why. For every public health issue, we need to ask ourselves at least 3 times why. And then when we answer that why, go back even more, get to the root cause. A lot of it, to answer your question, I truly believe is trauma, adverse childhood experience, trauma. Especially since the pandemic, we're seeing a rise in self-harm behaviors, suicide attempts, and mental health concerns. And that is why, you have to think about it other than just peer pressure. Teens and young people are wanting to do drugs and drink because they're trying to heal from something. They're trying to numb something. And we need to get to the root cause of why. So anything that we can do to booster up mental health services for youth, and that doesn't mean just, send them to a therapist. We need to think of non-traditional ways to help young people address their mental health. And I can come back to talk a whole time, but we only got 2 more minutes, so I'll stop there. Meet me in the back. Oh, one thing we could do too, this book is really special to me that I wrote. It's called Life is a Battle, But We Will Win. 7 interactive activities to help you win in the boxing match of life. I open up, I didn't even get time to talk about this today, but when I was getting ready to go into medical school in college, my 16-year-old brother died suddenly in his sleep. We believe it was from something called sudden unexpected death in epilepsy, but I open up in this book about how my life shattered when my baby brother died, but I had to say, and I had passive suicidal thoughts in college right before I was getting ready to take the medical school admissions test. And I had 2 choices. I could either give up or keep going. And so I talk about that resilience, the importance of support and mental health in here. And we've been doing a lot of great youth empowerment things with that book. So that's what we need to do. Figure out non-traditional ways other than therapy, but to support our young people, help them build resilience and heal from adverse childhood experiences and prevent the adverse childhood experiences in the first place. So that's gonna help with the alcohol and the drug problem. Thank you.
One more question if anyone has one. If not, that's fine.
You said a couple times, Dr. Jazz, adverse childhood experiences. Maybe you could just explain that for the room a little bit.
Yes, so there's been a lot of studies on adverse childhood experiences, and basically that's when some type of traumatic or hard event has happened to you in childhood before the age of 18. There's actually a list of certain things. It's a list of 10 things, and then people get a score. The more adversities they've had, the higher the score. And over the years, there have been adaptations to the adverse childhood experiences score sheet, but some of them include if you have experienced a parent who's been incarcerated, if you've experienced witnessed abuse in the home, other really hard things. And here's something I want you to keep thinking about. There's a lot of emerging evidence that is saying that children who had to live through COVID, that's gonna be the equivalent of a adverse childhood experience. There's a lot of emerging research about that. So then in the next 15 to 20 years, we're gonna really be seeing some of the adverse impacts of that, and we already are now with the mental health. So that's what adverse childhood experiences are. Thank you. And I'd love to meet some of you at that table in the back. Thank you so much for coming today.
Dr. Zapata, thank you so much for speaking with us today. We appreciate you making the time for the Downtown Madison Rotary Club. I hope you'll join us next week when the topic will be Wisconsin Veterans Museum. Every veteran is a story presented by Rotarian, historian, and director of the Wisconsin Veterans Museum, Chris Kolakowski. If there are no other items for the good of the body, I announce us adjourned.